Hi guys, it is Carla the Bubble Lush, and I just wanted to do an update. I guess I wanted to film this while everything was still kind of fresh in my mind. So today is Monday, August 9th. This morning I had my 36-week update. No, my 36-week midwife appointment, excuse me. And I'm 36 and a half weeks pregnant. Last time I was at the doctor was 34 and a half weeks, so 2 weeks ago. And I had requested that they do a blood draw because of some family history that came up that I wasn't aware of. So I went into my appointment this morning, and first I'll mention my weight was lower. I lost about half a pound in the past 2 weeks, which I don't know how I did because I've eaten a lot of food. I've been very, very hungry, so I don't know about that. I think part of it was I was retaining some water 2 weeks ago, and now I'm not really retaining as much water, and I just have gained a little bit of baby weight, so who knows. Anyway, so my weight was not a big deal. She took my blood pressure, and it was the best it has ever been, ever. Pre-pregnancy, pregnant, the lowest it's ever been. She had me go in, and I did the Group B strep swab myself. I wasn't expecting that. For those of you that have not done that before, it's they give you well, in my case, they gave me a tube, and it had some gel in the bottom of it, and a swab. Really long swab, and you swabbed it once around inside your vagina. Apollo is on high alert today, I'm sorry. You swab it once around in your vagina and once around your anus, and then you stick it in the tube, in the gel, and you're good to go. I was expecting the doctor to do that. I wasn't expecting to do that myself, so that was interesting. So that is done, and it's at the lab, and I'll find out the results next week. Don't really care. I don't really care either way. I did a urine sample like I always do, and they dipped it, and I had no proteins, and I wasn't even traced for proteins. I was not spilling any sugar, ketones, nothing. It was the best pee strip I've ever done. So imagine where I'm coming from. I have lost weight somehow. My blood pressure is the lowest it's ever been, and my urine results were amazing. So besides having to swab my anus, this was an amazing appointment so far. So Chris and I are waiting in the room, and there's a knock at the door, which the midwife always does before they come in, and I see Maggie come in, who's a midwife that I have seen a couple times before, but she wasn't the midwife I was scheduled to see today. It rotates around. So I was surprised, and I just thought there was a change in the schedule. And she was like, Carla, I came in today because, I met with you 2 weeks ago, and I wanted to introduce you to my colleague, Michelle, who you'll be meeting with today, and I've talked with her about our appointment 2 weeks ago and the blood tests that we ran, and she has been on the phone all morning becoming the resident expert on this because you are in fact positive for factor V Leiden. So I was like, okay, and I got a little choked up, I guess, because that was kind of scary to hear, because I have done some research, and although my mind went completely blank when they told me that I was positive, and I just remember thinking, this isn't good. So, alright, so factor V is a clotting disorder. It's a genetic mutation. It occurs about 5% of the population for Caucasians, and up to 13-15% of the population in some Swedish communities. So, you can either be heterozygous or homozygous, depending on, because it has to do with genetics. So, you get a copy of your factor V gene from both your mom and your dad, and if you get a a mutated form of it from both parents, then you're homozygous. And if you only get it from one parent, you're heterozygous. So I'm heterozygous, and considering it was brought to my attention because of my father's side of the family, my cousin having an issue during her delivery, I probably got it from my father, so now he needs to get tested for it. Basically, what factor V is, it's a clotting disorder, like I said. It puts you at increased risk for deep vein thrombosis, which is a clot in the leg. Pulmonary embolism, I think, which is a clot in the lung, and a blood clot in the brain, which would result in a stroke. Yeah. The scary thing is that when you are pregnant, you're at a hypercoagulated state, your blood is, and you also have a higher blood volume. So I think it's like your chances of getting a DVT, deep vein thrombosis, is like 7 times higher. So it puts you at an increased risk. Usually, I guess what happens, this is what usually happens. Somebody comes and they know that they have this factor V issue. And usually they have a history of, I'll get into that later, but anyways, when they do get pregnant, they're considered high risk because of the increased risk of blood clots and the effect not only it has on the mom but on the baby. And so since I am so late in the game, the question was, and what they needed to do was figure out whether or not I was going to be going on blood thinners before the delivery. Usually the treatment is they put you on blood thinners and then, a couple weeks before delivery they take you off. Well, I'm 36 and a half weeks pregnant, so do they put me on them for a week or two and then take me off, or what? So that was one of the questions that they needed to ask. And then I guess directly after delivery, you're at an increased risk for blood clots, so I will most likely be going on blood thinners for 6 months after delivery. And I'm going to meet with a hematologist, a blood doctor, and I guess kind of planning how we're going to handle this in my situation, because it's something that I'm going to have to deal with, I guess, for the rest of my life now. It's constant, it's always been present, but I just didn't know about it. One of the issues is after I deliver, usually you at your 6-week appointment, they consult with you about birth control options, and mine are going to be significantly reduced because any birth control option that has to do with estrogen is going to put me at even more increased risk for blood clots. It raises my risk 35 times. So that's not good. And the scary thing is that, I'd been on birth control before, and I was putting myself at risk when I did that, and I didn't even know it. So that's kind of scary. Let's see what else. Okay, so they talked to me about it, and then they got on the phone with some perinatologists and a hematologist, and it was decided that since I haven't had an issue with blood clots before, that they're not going to put me on blood thinners before delivery, which is really, really good. I'm very happy with that. They're probably going to put me on blood thinners afterwards. I'd be shocked if they didn't. And being on the blood thinners afterwards is not going to affect breastfeeding or anything. It's not going to affect Hannah. So that's good. What they're going to do is they're going to start having me do weekly non-stress tests, because the fear is a blood clot, it can happen in your leg, it can happen in your lungs, it can happen in your brain, but it can also happen in the placenta and in the cord. And so women with factor V are at an increased risk for stillbirth. So that is really, really scary. Excuse me. Okay, sorry about that. So it does put her at increased risk. And because the placenta can be affected, they probably won't let me go past 41 weeks, just because they want to be conservative. So, they also, having factor V puts you at an increased risk for low birth weight. So they want to do a growth scan. So that is going to be done, I think, the day I turn 38 weeks. That's already been scheduled. And then I'll have a consult with a perinatalogist afterwards. So I'm going to have weekly non-stress tests starting at 37.5 weeks, and a growth scan done at 38 weeks, which is, I think, the 19th. I also, I lost my earring. I also need to meet with a hematologist. Why am I having such a hard time with that name? A hematologist, to figure out what we're going to do as far as treatment afterwards. Okay, so as far as the factor V affects the delivery, the reason why I said I don't care whether or not I'm group B strep positive or not, I'm not stressed about it, is because the treatment for it, is a couple rounds of antibiotics. So they would have to put an IV in place. However, because, you are just kicking around, telling me to chill out, huh? Anyways, because I'm at an increased risk for bleeding issues during delivery, hemorrhage, basically, then they want to have an IV kind of in place from the get-go. Not necessarily having me hooked up to anything, but there's going to be an IV in place the whole time. So it doesn't matter if I have group B strep, because I'm going to have an IV anyways, so who cares? I asked about the water birth because if I was to go on blood thinners before delivery, then I wouldn't be surprised if they didn't want me delivering in the water. But since I'm not going to be going on blood thinners, they said that I could labor in the water and probably still push. That probably wouldn't be an issue of pushing in the water. I guess the issue is that since factor V is usually known ahead of time, and they are automatically, dealt with, they go through the doctors and they're considered high risk and very closely monitored, the midwives never see it. So it's a good thing that we know, because if anything were to go wrong and I was having an issue with bleeding, then, or clotting, then they know. So I guess whoever gets me, is going to have to read my chart. So that means that I need to put together a birth plan with all of this stuff mentioned in it. Yes, so in regards to fertility and factor V, women that have factor V, usually, if they don't find out about it because of a family history, they find out because they have a history of recurrent miscarriages. Because of the blood clot disorder, it puts you at a really increased risk for miscarriage. So, I haven't really talked about this, but when I was going through fertility treatments, I took baby aspirin, and I didn't tell my doctor. Don't do that. But I admitted it to the midwife. I was like, so that the baby aspirin that I took, that I self-prescribed while I was doing fertility treatments, that was probably a good thing. And she was like, yeah, it's probably the reason why we have a healthy baby today. She's like, you must have just known. Your body knew and you did it. And I was like, oh. I was told that it might help, so I did it. So, with future pregnancies, I'm at an increased risk for miscarriage, and will probably be monitored closer during future pregnancies with non-stress tests and growth scans and stuff. So, that was fun. That was a fun visit. I think that's about it. Because I talked about the risk to me, the risk to Hannah, the delivery, future pregnancies. Yeah, I think Chris got a little freaked out when they were telling him all the warning signs to watch out for blood clots and stuff like that. And, basically, pregnant women get leg cramps in the middle of the night. At least some do, and I do. And, but this wouldn't be like that. She said it would be a more localized pain and be like a hot poker, and it could be anywhere on your leg, not just in your calf. So redness and pain on your leg was an issue. All of a sudden, shortness of breath could be an indication that you have a blood clot in your lung. And then they went over the signs of a stroke, because that would be a blood clot in your brain. So that kind of freaked him out, and they were like, and you need to keep an eye out for these, her whole life. So that was fun. I think that kind of freaked him out a little bit. And then, of course, now there's a chance that I'm going to pass this on to Hannah. So, or future children. Yep. So, that was my fun little doctor's appointment today. They're going to try to, kind of keep it, I guess, as light as possible. The non-stress test, not a big deal. I'm not concerned about that. I am concerned about the delivery and kind of how that just kind of increased the risk of something going wrong, because I know that's what happened with my cousin. It went very wrong. It was very touch and go for her for a little bit. So that has me a little concerned, but everyone knows now that that's an option, so they're going to be looking out for the symptoms and warning signs for that. So I'm sure it'll be fine, but it was just kind of a lot to take in this morning. So if you have any questions, I'm probably not the one to ask. Just Google it. I really don't want to be bombarded with a million different questions, but I just want to let you guys know what was going on, and yeah, that was my 36-week midwife appointment. Thanks for listening to me ramble, guys. Oh, crap. I'll talk to you guys later.